I think that historically, and historically I'm talking, oh my gosh, to me it was just yesterday, but probably 30 some years ago, there was a surgical procedure that is no longer done, and it was done with good intent to help people to lose weight just by having the surgery alone, and it was by malabsorption. So you would reroute some of the intestines, so most of the stuff that you ate came out without a chance to absorb very much. American dream come true, I can eat whatever I want, lose weight. And the weight loss part was there, but you know, when you lose the calories, you also lose other things. So because it was kind of radical, the body couldn't figure out a good way to say, hey, buy calories, but I still need the protein, I still need the vitamins. And that was a lot of what I did in my residency, learning about the complicated, you know, parts of that and how to deal with the absorption issues. So I think, unfortunately, there's still a significant perception in the medical community that the only person that should even think about surgery is the last resort, you know, the end of the road, because nothing else is working. More and more people are understanding that surgery is not the end of the road. In fact, it's the facilitator, and for some people it's the middle of the road. It's never the beginning, because I don't know that I've met anybody who's had a little bit of weight problem who's never tried to diet. It's, you know, it's ubiquitous. But when the conventional dieting doesn't work, and unfortunately with a substantial amount of weight to lose, the failure rate's like 97%, because there's so much, it's so complicated. You know, who you eat with, when you eat, why you eat, what kind of stuff you eat, the fast food, we're grazing, you name it. I could go on for hours. But the help is a tool to help people to be better at dieting. And if, like gallbladder surgery, which is now outpatient, if a minimal incision, minimal pain, safe approach can be used, and by the way, the majority of the procedures, the most common procedures, are completely reversible. People don't think about it that, oh wow, if I have this and, you know, I don't like it or something happens, you can choose something that's very, very reversible, and gastric bypass is just as well as the banding is. There is that safety factor. The procedure is used to help somebody to be more effective, because it cuts down on appetite, it cuts down on the portion of the stomach that can accept food. So kind of like a funnel, if you eat too fast or eat the wrong kind of food, like a funnel, it's going to get to its full point, and most of us don't like to get sick. So just the thought of it is, okay, you know, my body's tapping me on the shoulder, and mostly you just get a little pressure. And then you have to put your fork down and push away from the table. And, you know, people do. So it's not a last resort. It's a permanent tool that can always help someone to be better. And it's also not perfect, because there's still choice. We have not been able to figure out the way to prevent all of us from grazing. That's the tough part, you know, and that's the American lifestyle. I'm a grazer. Pretty much everybody I know grazes. That's the trick. But the surgery itself helps people to become better, healthier dieters, and then better exercisers, and it helps them to make their behavior choices better. It's not perfect either, but the way I try to describe it to my colleagues is it's the same as you taking care of a patient who's a diabetic. You give them a medication, you have no guarantee that they're going to be compliant. You hope, and you try to give them the most effective medication. You don't look at the list and go, I'm going to start with the one that probably doesn't work very well. At some point, for many of the patients who already have diabetes, high blood pressure, and cholesterol, there's this thing called metabolic syndrome. So very rapidly, they're going to start developing high risk factors for stroke, heart attack, congestive heart failure. And so the years tick on, but a lot of people during those years develop those types of diseases, and sometimes, unfortunately, mortality from that. So people who are significantly overweight and have had those kind of disease processes for years, the body's really taking a toll. And I think it's important. I don't like to use the word aggressive, I like to use the word effective. With safety being number one, you certainly need to choose something that's safe, but then you want effective to be right behind it. So I think it's something that should be considered as an adjunct well before it's the last resort, because it can help people to get healthy.